I happen to believe, and I know not everybody agrees with me, I believe that health care is a right of all people. I believe that there is something wrong when we are spending...
Excuse me, where did that right come from in your mind?
Being a human being. Being a human being. And what I believe, Brett, you may disagree with me, I believe that if she is poor and you are rich, she is entitled to the same quality health care that you have because she's a human being. But in any case, when we talk about our health care system, this is important to know. It's not just that we have 29 million people without health insurance, and that we have many more who are underinsured, and that we are getting ripped off big time by the pharmaceutical industry, who are charging us the highest prices in the world. But that we end up spending, and you can explain it to people,
sure.
Maybe. Why do we spend 3 times more than the British do per person for health care? Why do we spend 50% more than the French? And why do we pay the highest prices in the world for drugs?
I rise to oppose this bill. As elected representatives, we have a mission, an obligation, and a mandate to fight for each and every American. I ask you, Mr. Speaker, who will stand for the American people, who will speak up for those who have been left out and left behind. Mr. Speaker, I've said it time and time again, health care is a right. It is not a privilege reserved for a wealthy few. For what does it profit this body to pass this bill and lose our soul? This bill is a shame. It is a disgrace. Mr. Speaker, today my heart breaks for the disabled, for women, for seniors and working families. My heart aches for those who are living paycheck to paycheck. My heart mourns for innocent little children whose very lives depend on if their family can pay the bills. This is the right and wrong of it. This is the heart and soul of the matter. We cannot abandon our principles. Mr. Speaker, we cannot forget our values. Have fought too hard and too long to back down now. I will fight any bill that turns the clock back to a darker time. I will fight every single attempt to turn a deaf ear, a blind eye, and a cold shoulder to the sick, to our seniors, and to working families. Mr. Speaker, I will fight every day, every hour, every minute, and every second. I oppose this bill with every breath and every bone in my body. We must not give up. We cannot. I will not give in. Not today, not tomorrow, and never, ever. On this bill, there's only one option, and that option is to vote no. We can do better. Mr. Speaker, we must do better. Vote no on this bill.
Over 2 million women in this country have chosen Planned Parenthood as their choice of health care provider.
Millions of women are helped by Planned Parenthood.
Planned Parenthood is defunded, then where will millions of women, low-income groups, and
it's a good question.
The Republicans talk a whole lot about choice. Oh, they love giving everybody a choice.
You believe in providing more choice for people when it comes to health insurance, except for Planned Parenthood.
Planned Parenthood is now providing vitally important health care, cancer screening, other types of health care services to some of the poorest people in America. And I will defend Planned Parenthood. What I say is not only do we stop the Republican efforts to try to defund Planned Parenthood, we should expand funding for Planned Parenthood.
That's the grit.
One of the major healthcare crises facing this country is the high cost, the outrageous cost of prescription drugs. And yet, if you turn on the television screen, you're going to hear virtually no discussion about that. Maybe that has something to do with the fact that the pharmaceutical industry spends tens and tens of millions of dollars advertising on those stations. What do you think? The cost of prescription drugs in this country is obscene. Millions of people cannot afford the cost of those medicines, and costs are soaring.
People with pre-existing conditions will be protected. Insurance companies will not be allowed to deny them coverage. But my understanding is, as you just mentioned, this new legislation would allow states to opt out and allow insurance companies to refuse to sell insurance to people with pre-existing conditions as long as there's some setup for them, pools of some sort. Is the president sending a message to Congress to change that provision, or did he not understand what was in the bill?
Well, that's not my understanding of the way the bill has been reframed. My understanding is that it will allow insurance companies to require people who have higher health care costs to contribute more to the insurance pool that helps offset all these costs, thereby reducing the cost to those people who lead good lives, they're healthy, they've done the things to keep their bodies healthy. And right now, those are the people who've done things the right way that are seeing their costs skyrocketing. Now, in fairness, a lot of these people with pre-existing conditions, they have those conditions through no fault of their own. And I think our society, under those circumstances, needs to help. The challenge, though, is that it's a tough balancing act between the higher cost of these mandates, which denies people coverage because they can't afford the health insurance policies anymore on the one hand, and having enough coverage to help those people who are truly in need. And it's a very complicated question, and I'm sure over the years there'll be different permutations of it, both in the past and as we go forward.
They said that 24 million fewer Americans will have health insurance in 10 years under your plan. You said that part of that is that this is what freedom looks like. Here you are.
This isn't a government mandate. This is not the government makes you buy what we say you should buy, and therefore the government thinks you're all going to buy it.
But, sir, is the major decrease in the number of people, according to the CBO, who will have health insurance, is it freedom, or is it that some people will no longer be able to afford health insurance under your plan? I want to show a specific case that the CBO put up. Look at these numbers. In 10 years, the CBO said, a 64-year-old with an income of $26,500 will pay $1,700 out of pocket under Obamacare for health insurance. Under your plan, the CBO says, that same person will have to pay $14,600 because insurance companies can charge more, and the tax credit that you're going to offer is smaller than the subsidy that Obamacare will offer. So what they're saying is this isn't freedom. This isn't people voluntarily deciding not to have health insurance. It's that your plan makes it unaffordable for people.
Congressman, have you read the bill?
Concerned about voting on this without...
Congressman, have you read the health care bill? Congressman, have you read the bill yet? Yeah. Morning, Congressman. Have you had time to read the health care bill?
We're still working on it.
Hey, gentlemen, have you read this bill, Congressman? Congressman, have you read the bill?
No, we're in a hurry. We'll be back.
Congressman, have you read the health care bill?
But for 7 years, my Republican colleagues had no interest in doing that. All they wanted to do is repeal the bill, repeal the bill, repeal the bill, and offer no alternative. Now we see their alternative, and it's an awful alternative. It is a disaster. It is an alternative that came not out of a deliberative process, but out of some back room somewhere. People haven't even read this bill. They don't even know what it does because we're not even waiting for a CBO score. This is a pathetic process that everybody should be ashamed of. And let me just say, to claim or to imply that the Republican plan covers people with pre-existing conditions is a lie. It is a lie. And let's be honest about it. This does not cover people with pre-existing conditions. And to come on the floor and say it does to try to fool people, well, you may get away with it in the short term. You may get a headline. But I'll tell you, people will figure out soon enough when they're denied health care coverage, when they see their costs rise and rise and rise. To have a health care bill that throws 24 million Americans off of health insurance, you should be ashamed. You know, to have a health care bill that cuts Medicaid by $880 billion so you give a tax cut to the wealthiest people in this country, you should be ashamed. And I spent a good deal of my time reading letters from organizations like the National Farmers Union, the AARP, the Cystic Fibrosis Foundation, on and on and on. Organizations that have dedicated their lives to help people in this country that know something about this subject. And when it comes down to who do I trust, them or you, on whether or not your bill covers people with pre-existing conditions, there's no contest. I trust them. It is unconscionable to not only me and to people on our side, but to people who are watching this debate, Democrats and Republicans and independents alike, that we would be spending time debating a health care bill that will make life worse for people in this country. You know, any kind of health care bill that came to this floor ought to be about expanding coverage and lowering costs. We want to work with you on that. And instead, you come to a bill that's going to rip health care away from tens of millions of people. How can you do this? Terrible bill. You should vote no on it, or better yet, pull it. I yield back the balance of my time.
The gentleman's time has expired. House will be in order.
Let me break the bad news to the President. Mr. President, I'm sorry to disappoint you. This bill, in its current form, is not getting through the Senate. No way, no way. You take this bill and you know, we don't want to clog up toilets or anything, but you just toss it into a garbage can and you start again. This bill is a disaster. It is an embarrassment. And I want to say to the people who voted for Trump, and I know that many of them are decent people who actually believed what he said during the campaign. Remember what he told you?
I am going to take care of everybody. Everybody's going to be taken care of much better than they're taken care of now.
Providing health care to everybody is not throwing 24 million people off of health insurance. This health care bill is an embarrassment. It's an insult to the American people. And in the Senate, we will start from zero and do something that will work for ordinary Americans.
Mr. Trump, come down from Trump Tower and talk to the American people. I came from California to tell the truth about this fake health care bill. This is not about health care reform. This is about disease, death, and suffering. Mr. Trump, come down from Trump Tower, walk among the people, and see the damage that this latest exercise in raw political power will wreak on the women, the men, and the children of this country. In California, we're not talking about a few thousand, we're talking about millions of real people getting hurt, getting diseases that will not be cured, having heart attacks, not being able to go to a hospital or get a doctor. This is a dangerous bill. It's written by people who don't know what the hell they're talking about. It is so big, so complicated, that I doubt if any member of Congress on the Republican side has even read it. I know the people in Trump Tower have not read it. We ask you, do what you said. Cover every American with real health care.
of a completed or attempted rape before their freshman year in college. I can't even fathom that. And the fact that that may be considered a pre-existing condition, and you call that not discriminating against women? What happens to how awful I say that?
I'm not going to reduce this violent act.
You are reducing the experience of sexual abuse victims by not answering questions about their livelihood and how it will affect them.
What I will say is that this bill does not allow discrimination in health insurance.
At this point, you can say what you want, but I think we all know the truth.
You cannot expect people to be good consumers of healthcare. Another wonderful talking point. Thank God for the GOP for giving us that one. We need to be better consumers of healthcare. You're supposed to be vetting doctors and vetting hospitals and knowing what an MRI costs and knowing what a CT scan costs. And if I need a cardiac catheterization, how much does that cost? And does it cost different if I have this doctor or this doctor? It's completely immoral. And this is the point, Congressman. This is the point. Because health insurance as a for-profit business is immoral. When I am drowning and you insist that I pay before you will save me, that is immoral, sir. Completely. You have no legs to stand on. You want to make money off of me. If you're in insurance, you want money off of me. And the reason that it's not going to go to single payer is not because you don't believe it. It's because you know that the insurance companies have a powerful lobby and they would decimate you.
We have a failing health care. I shouldn't say this to our great gentleman and my friend from Australia because you have better health care than we do.
They do have. They have universal health. I know. I thought you would.
Oh, okay. Wait a minute, Chris. All right, the president has just said it. That's great. Let's take a look at the Australian healthcare system, and let's move. Maybe once take a look at the Canadian health system or systems throughout Europe. Thank you, Mr. President. Let us move to a Medicare for all system that does what every other major country on earth does: guarantee health care to all people at a fraction of the cost per capita that we spend. Thank you, Mr. President. We'll quote you on the floor of the Senate.